Amref Health Africa is Africa's largest indigenous health development organization, operating in up to 35 countries depending on our project footprint at any one time. Having been in Africa for the last 63 years, we know that actually community context matters, policy context matters, strategy and priority, country priorities matter, and therefore we do not take that one size fits all, and therefore we believe in a unique Africa health agenda. It is with this in mind and with our vision of lasting health change in Africa that we decided to be convening every 2 years a big convening, which is the Africa Health Agenda International Conference, or in short, Africa Health Conference, which happens to bring together governments, bring together the young people, bring together policymakers, practitioners, communities as well, advocates, partners from Africa and from across the world to discuss the Africa Health Agenda on African soil. We have held several of these conferences, and the most notable is the one of 2019, where we brought over 1,800 delegates from 49 countries into Kigali, Rwanda in March 2019 to discuss how Africa was prepared and preparing to achieve universal health coverage by 2030 to ensure everyone has access to quality health services without financial difficulty in an unaccountable manner. We had over 7 ministers of health attend from Africa. We had over 500 young people come together for a youth conference, and out of that was born the Youth for UHC movement. We brought conversations of private sector engagement. We brought conversations on civil society engagement for UHC movement. At that point, the world was preparing for the UHC declaration at the UN General Assembly in September. We used this convening to bring different voices of different people to the UHC declaration, and we contributed significantly by participating together with the UHC 2030 committee. So far, we have actually achieved a lot, including looking at country case studies on UHC, releasing a communique which has been referred to by different bodies as they develop their plans for UHC. And then COVID happened, and COVID found us when we're now preparing for the next convening, which is supposed to be 8th to 10th of March 2021. And because of COVID and the uncertainty around the pandemic and what we may call probably a bumpy tail of the pandemic that is uncertain, a second, third and fourth wave that is uncertain, we have decided that we are going to host the Africa Health Conference virtually. It is going to be held on 8th to 10th of March 2021. Planning has started in earnest, and on top of that, we have actually decided to also include an Africa Health Agenda Commission that is going to do a report on the state of UHC in Africa, what achievements have been made, and what barriers exist that Africa needs to overcome. This commission will be working, will be calling out for commissioners, and will be working closely with Amref Health Africa and our partners to deliver a report at AHAIC 2021 in March. We look forward to all of you participating as partners. Come on board, let us make this the best convening to look at post-COVID-19 universal health coverage plans and strategies as we get closer and closer to 2030. Actually, we have no time to waste. So we call upon you to be a participant by contributing to our content. We call upon you to be a participant by partnering with us financially to ensure we can bring the best content to the people and ensure everyone is able to have this conversation. We call upon you to assist us to do the necessary research we need to deliver the policy documents that we need for this conference. We call upon you to be part of AHAIC or Africa Health Conference 2021, March 8th to 10th. Please join us. Thank you.